Let's take you live now to question period. Let's listen in live.
Not every Ontarian has an OHIP card. Migrant workers that help keep our agriculture sector going through backbreaking labor, out-of-status workers in the construction sector who face risks on the job, and refugees fleeing violence and conflicts around the world. Through you, Speaker, does the Premier think the uninsured should be eligible for urgent medical care?
Deputy Premier and Minister of Health.
Thank you, Speaker, and congratulations to the member from Hamilton Centre on your victory and coming here to join us in the House. You know, absolutely. We as a government understand the valuable work that our immigrant workers play, which is why we continue to fund those services through OHIP-funded services. You know, the member opposite has on the NDP website today, right now, false information, Speaker, and I don't use that word lightly. They are suggesting to the general public that individuals who have come here and ultimately not and have come to Ontario are not going to get services in the province of Ontario. It is factually incorrect, and it continues to be on the website, even though multiple sources, including the Toronto Star, has told them that, in fact, that is not the case. Would the member opposite respectfully return that, remove that false information from their website?
I'm going to caution the Minister on her language. Supplementary question.
Wow. Well, Speaker, this Minister of Health should be listening to the physicians across this province who are telling her what this is going to mean for their patients. On a very busy Friday, it was revealed that the government is eliminating the Physician and Hospital Services for Uninsured Persons program. This is going to make it harder for refugees, for unhoused people, and for those with mental health challenges to access urgent health care. That this government is making these cuts while redirecting public money out of public care and into the private pockets of a few connected people makes this even more shocking. Speaker, my question is to the Premier. Why did his government choose to eliminate this simple yet compassionate program?
Minister of Health.
Member opposite should know full well that this program was put in place when individuals could not travel in the province of Ontario. At the beginning of the pandemic, when we had limitations on individuals who needed to be able to return to their homes, to their home communities, that was removed. Because of that, we put in a funding model that ensured that individuals who were in Ontario could get the medical coverage they needed. I want to reinforce, you know, we have 75 community health centres spread across Ontario that have funding models that ensure that they can provide necessary health services for individuals for any number of reasons do not have an up-to-date OHIP card. We have temporary foreign workers who have programs provided by the federal government to ensure that they have health care funding in the province of Ontario. Again, Speaker, I would urge the member opposite to take down the misinformation because it is seeding unnecessary fear in the people of Ontario, and it's wrong.
Stop the clock for a second. Stop the clock. Yeah, I'm going to again caution the member. It's causing some concern on the other side of the House, but I don't believe that the minister said anything unparliamentary. Final supplementary. Leader of the Opposition.
The answer is they are going to go ahead and end that program. That's what we're hearing now. And I want to try this out on you. Devastatingly cruel, a big mistake, a regressive decision, harmful and cruel, unconscionable. Not my words, Speaker, but those of physicians across this province who are talking about this government's decision to eliminate this program. Speaker, the Premier seems to have no problem finding ways to help out people that he knows, his friends. But when it comes to helping Ontarians who are in need, he's willing to turn his back. So my question to the Premier again is, will he reverse his decision to end this program and finally put those in need ahead of his insider friends?
Members will please take their seats. Minister of Health to reply.
Mr. Speaker, I will be as I can, unlike the NDP news release that is spreading false information. There is no change.
I'm going to ask the minister to withdraw.
I withdraw.
Include her response.
I would respectfully ask that the NDP take down a press release that is seeding fear unnecessarily in the province of Ontario. There's no change in the way that uninsured persons will receive care in the province of Ontario. The only change is how hospitals, community health, and midwifery centres will be reimbursed for ensuring and providing that care. Thank you, Speaker.
The next question, the Leader of the Opposition.
Speaker, I'll tell you something else that Ontario needs. Ontario needs 1.5 million new homes over 10 years to keep up with demand. The NDP has proposed many ideas. Yeah, we do.
And ask the government side not to interrupt the Leader of the Opposition when she has the floor the way they just did. Please don't do it again. Restart the clock. Leader of the Opposition has the floor.
We need them. These folks aren't delivering them. The NDP has proposed many ideas to achieve this, such as updating zoning rules to allow more affordable missing middle housing, investing in hundreds of thousands of new, affordable and non-market homes. The government has said no to every single solution we present. Instead, they focus their attention on carving up the Greenbelt, a decision that will only help a few insiders while everybody else is being left behind. Speaker, the government's own budget shows that new housing starts are going down in Ontario instead of up. Does the Premier really think that his plan is working?
To reply, the Minister of Municipal Affairs and Housing.
Speaker, over the last 2 years, housing starts have reached a level that this province hasn't seen in over 30 years.
That's right.
Last year, Speaker, rental housing was at an all-time high. We've never had more rental housing starts than we did last year.
Fact.
Speaker, the member can say all she wants, but the facts are right in answer. When we proposed to give a break to nonprofit housing, they voted against it. When we decided to make it cheaper and easier to build more purpose-built rentals and provided those incentives, her party voted against it. Time and time and time, we present positive opportunities to create better general density in neighbourhoods, more rental opportunities, more nonprofits. It's the NDP that is the party of no. They are the ones every single.
And we'll take a seat. The supplementary question.
Okay, we've been listening live inside the Ontario Legislature to question period. Earlier on, we heard Health Minister Sylvia Jones asking the NDP to take down a press release which she claimed was not factual on their website. NDP leader Marit Stiles accusing the Ford government of removing an uninsured persons program, making cuts to it, saying that many physicians are calling it devastatingly cruel and unconscionable.